Hi, I'm Kanav Kahol. I'm the team leader of the Division of Affordable Health Technologies in Public Health Foundation of India, and I'd like to present to you our newest product or newest invention, which is actually called the Swasthya Slate. So that essentially is the concept of a Swasthya Slate, and the idea was that we need at the point of care diagnostics, which is what really mHealth needs. So what we wanted to do was to interface a bunch of diagnostic tests as well as sensors with an Android tablet, an affordable Android tablet as well as an affordable Android phone, so we could actually show that these things can actually be automatically captured into the tablet, put onto a central database where we can actually then go ahead and enable the healthcare workers to record data in an automated fashion, enable the doctors to be able to see this and supervise it, as well as enable public health researchers with all their needs for epidemiology and so on. So what this is essentially is it enables us to capture the data in an automated form. This is essentially the board. We haven't actually covered it. Just so that you can actually see what's going on. It's got a Bluetooth sensor, so there's actually no wire that goes from the board into the tablet, but essentially what this does do is it looks at four things right now. There's a temperature sensor, which is essentially right here. We've got a water quality meter that it plugs into right there. This is our heart rate sensor, and again we cover all of this up in this, and these are our 4-lead ECG. We wanted to test this out because it enables us to really get a sense of how much data it can handle and where it can actually go. Here is examples of 3 different kinds of Android platform that this is already working on. You've got a phone on which this actually works. You've got a cheap Reliance tablet that's around $240, 12,999 rupees, as well as a more high-end tablet where this actually works. So let's actually show you the thing. Let me just turn this on. So this is as easy as it goes. You see the little green light that comes up. Let me plug in the water quality meter into it. We've got the heart rate sensor, and I'm just going to use this particular tablet to show it to you. I switch on the Swasthya Slate. I go ahead and say connect. It'll tell me to choose the Swasthya Slate, so I'll go ahead and choose the device Swasthya Slate. After a while it should give me a message that it has been able to connect it. It says connected successfully. Now let me actually just go ahead and give you an idea of the water quality, so you can go ahead and see as it's going. I can actually go ahead and put that in. Let me move this to the parts per million, and you can see it automatically records what are the parts per million in the water quality. And again, let's put it in another kind of water, and you'll be able to see a big difference in terms of how that actually goes ahead. So you can actually go ahead and see how it moves on and moves further. We've got the water quality into the system. Let's take a look at the heart rate. What I'll do is I'll just go ahead and put my finger into it, and you'll see the little green light on it going through, and after around a minute or so it's actually went ahead and averaged the thing, and you'll be able to see my heart rate into this system, and you can see it's around 119, 112. I'm kind of excited talking to you, which is what's actually allowing us to do that level of thing. Let's take a look at the temperature. Again, I press the back button and I can go ahead and do the temperature here, and you can see as I hold it, the temperature is actually changing and calibrating to what it should be, which is 98.5. So we've got all those things already working. Let me hide this, and then let's actually look at the ECG, which will just require me to put on these leads. So I'll go ahead and do that. I've already put the electrodes on myself. That should allow us to do that. So there's my right arm, there's my left leg. I'm going to put that onto my left leg, right? And then here's my right leg. I'm going to put that onto my right leg. So I've got all these in place. Let me turn the ECG on, and there you go with the lead 3. Here's my lead 1. That'll actually give you the value. So you can see it's actually handling a lot of data, and if you can see, if you actually go ahead and put my feet down, you'll see a little change in the way it's done because it's grounding. Here's my lead 2. So you can see that it's actually able to capture high volumes of data through this particular system. That in a sense is what it is. Once I actually go ahead and disconnect this system, it'll actually upload all the data onto our server that allows us to do this. Again, it works with this particular device, works with this device, it even works theoretically it should work with Akash, because we know that it works on Android 2.2. So that's our little thing to empower the healthcare workers so they can carry this device with themselves from village to village, gathering information and being able to move on. Our future plans include interfacing blood sugar, blood pressure, urine protein sticks, all of these with the Swasthya Slate. And if you have any questions, feel free to email me at kanav.kahol@phfi.org. Thanks.